A warm welcome to everyone. I would like to introduce you to our newest European project, which is called Desire, which stands for Development of eHealth Solutions Improving Resilience in Europe. So we are actually one of 2 Euroclusters in health formed by the European Union. I see that some of our partners are also online. Tommaso, I've seen from Eurobiomed, from our French partners. Also, Lisa from ICS, so from our local partners. And our project will just started this September and will last until August 25. Our scope is that we want to support SMEs in European e-health and digital health market access and facilitate their green and digital transition. As I mentioned before, we have several cluster partners from around Europe. So Eurobiomed from south of France, Interhorizon from Poland, Cluj IT from Romania, and here from Styria, the business support organization, the Internationalization Center from Styria, and ourselves, Human.technology Styria. And what are we exactly doing, or what is our focus? So we currently established a collaboration platform, which is a totally free online platform where I will encourage you to register there, because you can also reach out to Eva afterwards. Yeah, so she already registered with her profile. We will organize different, in total 12 collaboration events. This today is the first event, which like a small event is a start, and we will have a wide variety of consultation meetings with different stakeholders from the healthcare industry. We'll set up trainings, and most importantly, we have around 1 million euros of funding that we will hand out to SMEs from all countries of the European Union. So in total, 35 SMEs with maximum 30,000 euros grants that can be used for product innovations or business process innovations or internationalization. So if you want to find more about our funding or other opportunities, you can contact me, or the best way would be to register at our online platform. I will send you the link in the chat, but you will also receive it afterwards per email. So now it's my turn to introduce you to our keynote speaker today. I guess why most of you are here today and listening. So it is my pleasure to introduce you to Eva Schitter, who's an Austrian, but is located in Rotkreuz in Switzerland at Roche Diagnostics International. And today she's, as you can see here, a digital health innovation manager, and she will talk about digital ecosystems with an special focus on how you can collaborate with Roche Diagnostics. So I think this would be highly interesting for you, and please prepare some questions, otherwise I have to ask all the questions. So Eva, I'm looking forward to your presentation.
Thank you very much, Pascal, for the kind intro, and also thank you for having me here today. It's really a pleasure to be able to share the view how Roche Diagnostics tries to shape the digital health space, but even more so how we do that not alone, but with partners all across the world. So the aim today is really to give you a flavor where on the one hand, we see from the Roche Diagnostics perspective the biggest challenges in digital health but also give you two very concrete examples on how we work with innovators around the world to actually overcome these hurdles in digital health. And apart from talking a bit about our digital solution space that you see here named under the navify term, I will also talk about the startup Creasphere, which is our innovation funnel for, let's say, even earlier innovators that not yet have a market-ready product. But without further ado, I'll jump right into the topics and look very much forward to your questions afterwards. As said by Pascal, my name is Eva Schitter. I work as a digital health innovation manager within Roche Diagnostics Global. So I'm responsible for primarily the innovations in the cardiovascular and metabolic indication space, and work there with startups from Silicon Valley all the way to Finland and Australia on these kind of topics. So if you have any practical questions, happy to address them also later. Our vision is really to connect the healthcare system and make it more agile, and that by deploying the right digital solutions to unlock the new possibilities in care. We have a lot of innovations out there, but often we struggle with connecting those, and this is one of the biggest priorities. So one step is deploying the digital solutions along the care continuum to connect the healthcare community all the way from the labs to urgent care to elderly care homes, or even to the home of the patients, to enable the data flow across this continuum. But it's not only about enabling and connecting the data, it's also about optimizing workflows and generating insights based on the data you connect and the data pipes, quote unquote, you build along that ecosystem. And last but not least, in healthcare, we see it also as very, very important to have secure data ecosystems that are open to bring in additional data and share, but are built in a secure manner when it comes to data privacy, and have very robust data privacy approaches. And ultimately, that should improve not only the clinical insights and improve the operational work in those various healthcare settings, but also translate into efficiency gains that in hindsight translate into a financial value. But what does that now mean practically? It's about focusing on medical insights from all the way from the lab to the point of care, to the hospitals, but also to home of patients, and having really the patient at the focus, and not just the data, or not just the healthcare providers and labs. It's about driving efficiency and also raise the health equity in the system. And I think all across Europe, it's a big topic. How do we enable value-based care? How do we enable a much better care by tracking outcomes and not tracking volumes? This is also a central part of the operational excellence that we want to facilitate. And last but not least, all of that can only be facilitated if you have the right digital infrastructure in place to integrate the data streams across the continuum. From a Roche perspective, we do that with quite a variety of our portfolio. We have the navify core integrator that is integrating data streams from the labs to the hospitals, to the physician offices, but also bringing data from the so-called handheld devices to the physician office, for example, if you do a home visit. But we also have certain marketplaces in place for apps, for analytics software, and a few other examples. But today I really want to focus on two particular examples. One is the navify marketplace, and the other one is the so-called navify algorithm suite, because I think these from my perspective are the biggest points where we collaborate with startups and SMEs all across the world. if I focus now on the algorithm suite example, what we try to solve here is enabling the deployment of clinical decision support algorithms, often based on laboratory information, again, along the patient journey. Because you have, as a physician, you are faced with thousands of potential algorithms you can use. You're faced with a multitude of new guidelines. You're faced with a vast majority of data, but it's super hard to, on the one hand, know which algorithms have the right evidence and are implemented in a regulatory compliant way. It's also super hard to just digest the amount of data you're faced with. And with those challenges, the algorithm suite tries to help by implementing the algorithms in a regulatory standard manner. You can think of it sort of as an app store for clinical decision support algorithms, where we have our own algorithms, but we also have algorithms from partners. And they are not just in a part of the diagnosis where we as Roche Diagnostics usually operate, but we also have algorithms all the way up the patient journey to the prevention space, where it's more about triaging the patients to the best treatment, or even the next diagnosis step, all the way to optimizing treatments, and then do also the follow-up in the disease management space, where we more and more focus on also patient-facing apps, disease management apps. As I mentioned, we really want to enable the physicians to make better decisions for the patients. And this is where we have, on the one hand, our own algorithm pipeline, but we even more so focus on algorithms that come from partners, that can be research institutions, that can be startups developing algorithms. It can have various sources, but it's really about bringing them all together in a catalog of quality controlled, certified algorithms with the right medical evidence, and then provide one single interface that brings in also the required data from lab information systems, but also from electronic medical records, as you often need this additional information to calculate medical and decision support algorithms, and then share back the result with the laboratories, with research institutions, but even more so also with hospitals and healthcare professionals. So you can imagine that sort of as you get a particular heart-related biomarker, and it's above a certain value, and you get that from a person that is above the age of 65 and is a female. So we have then evidence-backed algorithms that gives you a risk stratification. Do I need to see that person again in 3 weeks, or do I need to see that person again in half a year, for example? So that kind of algorithms. Now I want to switch gears a bit more towards our point of care platform. So here I talked a lot about clinical decision support, about a marketplace where you can sort of submit is maybe the wrong word, but you can really bring your developed algorithms on top of that algorithm platform. When switching gears now, I'm talking more about a point of care ecosystem, digital ecosystem. Point of care, for those who are not so familiar with, are devices that are either handheld by nurses, by physicians, to track or measure certain biomarkers, but it can be also so-called benchtop devices. So imagine if you go to a general practitioner and they often have this little lab in the corner with machines. These are point of care devices. So I'm switching gears now to from the clinical decision support space to the point of care space. And in the point of care space, we I just realized that I'll switch to the point of care space in a moment. I just want to finish off the algorithms with mentioning that it's at the moment we focus on oncology, pharmaceutical industry related algorithms and cardiac algorithms. But even more so, we have additional algorithms for special indications coming from third parties. But now I'm switching to the point of care. In the point of care space, we are faced with an increased decentralization of patient care. So where in former times you would need to go to the hospital for nearly every diagnostic or treatment step, we are moving it more and more towards the outpatient setting and more towards the patient homes. So how do you now get the values that are measured at the patient home or in an elderly home back to the physician? There's some digital infrastructure needed. And this is one of the key challenges we face in the point of care space. And all of these devices also need to be managed and be taken care of. We need to enable the point of care testing in various settings. As said, if there is a nurse in an elderly home doing a finger prick blood test, it's a very different case than if a cardiologist in the hospital ward is doing a test. So we need to enable that many more, let's say, less specialized people can also do diagnostic and point of care testings. And last but not least, it's really about integrating then the data and enabling the digital transformation by just having the right data available at the right time. And this is where we have at the moment the focus on when we talk about building our point of care solutions and are also building around the digital infrastructure around our point of care solutions. To give you a bit of a flavor of how such a point of care device even looks like, what you see here is our so-called Cobas Pulse. And I know the team from Steady Sense is more than aware of that device, I suppose, if you're on the call. But it's a handheld diagnostics device. It was developed in the beginning as a glucometer, so basically to measure blood sugar in hospitals and physician offices. But by now, it's really sort of a medical smartphone where you have an Android operating system running on it. It has a touch screen that can be disinfected. It has a barcode reader. It can read RFID patches and many more. And alongside that device, we developed an app store for medical apps. And this is the second part where we work with a lot of innovators in building that digital ecosystem related to the point of care device, but also beyond. It's called the Navify marketplace. And there, you can really think of it as an app store, like an Android or an Apple app store, where you as an innovator, as a startup, as a SME, but also bigger companies can offer their apps, and then it's Roche would get just a portion of the revenue, and you get most of it, and it's deployed on those point of care devices. For example, we work with companies like Glucotap, Glitech, more in the diabetes care space. We work with Immuto Wound in wound care. Smart for Diagnostics is more focused on sample tracking, and Steady Temp is a patch to measure and track the temperature. And Cardio Signal is really a device that can detect atrial fibrillation or heart failure in the future by just placing the device on the chest. So there is a lot of innovations going on there, and even more can come on it as it's structured as a medical smartphone. Those devices are managed by a Roche customer portal, so that means we have even remote customer support for the devices, and then also for the operating system on it. And we are developing future systems that also use those smart medical devices. It's not only about being an open system on the application side, which is mentioned here on the right, where it's about ensuring interoperability. It's about integrating with third-party software and clinical decision-making and workflow efficiencies. It's also about being an open system towards other point-of-care devices and other data streams where we connect with non-Roche point-of-care devices to access the relevant medical data for creating clinical decisions. And it's also here the robust data privacy approach is always at the center. So we talk here about medical grade devices, but also really high cybersecurity standards when it comes to data sharing. With that, I want to close the round on the navify and how we want to enable better care and enable that on a personal level, so going as individualized as possible to the patients, and switch more towards what I mentioned in the beginning, the so-called startup Creasphere. Because what we are deeply convinced is we cannot do it on our own. Even though Roche might be a global company, it's certainly not something we can do alone. This healthcare, and especially the challenges in digital health, is something we love to tackle together with other innovators around the world. And here, I want to give you just a flavor of our startup accelerator, the so-called startup Creasphere. It was established about 4 years ago together with Plug and Play. And what it does different to some of the other accelerators, it's very much focused on pilot projects for finding solutions to a very dedicated customer and business need. So it's not a startup zoo, it's really a collaboration funnel for long-term partnerships within Roche. We have 3 different hubs at the moment, one in Silicon Valley, one in Munich, and one in Singapore, covering the various geographies, and focus on technology areas like advanced data analytics, digital biomarkers, more and more on disease management applications, also how the lab would be structured in the future. I already mentioned clinical decision support, that is really at the center, and also digital service solutions. So how can we service our devices, for example, remotely? The process, the startup Creasphere process in a nutshell works as a program, and it's always run in a rather similar fashion, where we start with selecting and scouting startups based on certain focus areas and very strategic priorities, and that happens twice a year. And it's a stepwise evaluation cycle of those startups. And after a company is selected and also agrees to work with Roche, then a 3 months co-creation process starts, which is really coined by mutual learning from working on concrete examples, very openly sharing expertises, but also sharing where we face challenges. Alongside that pilot project, you get coaching and you get also matchmaking with other players in the healthcare space, and you get an external network as well as a bigger Roche internal network. For that process, we are accompanied by Plug and Play. And only then, after the startup Creasphere program, when it goes into a follow-up, Roche is sort of fully taking over. And we've seen many examples. We've seen co-development, we've seen studies that came out of those collaborations, we've seen co-marketing, co-commercialization agreements, but also some companies became standard suppliers to Roche. And where we are very proud of is that 50% of those collaborations really had a follow-up, had a next step after that first 3 months of acceleration. It's about contributing to digital transformation together. And there are 3 layers of, we call them 3 layers of opportunities. It's about either we focus on tapping into new businesses, where we as Roche say as well, we have no super clear idea yet how disease management platforms for cardiovascular conditions, for example, look like. What is really the differentiating factor there? In this pillar, we work with companies to not only shape new technologies, but also shape new business models with customer segments that are not so familiar for us yet. In the middle pillar, that is more the augmenting of our core business. And here, I've mentioned the point of care device example earlier. It's more about a business that Roche knows quite well, and we bring on board new partners to fill certain gaps in a portfolio, for example. But it's, yeah, we often have already existing customer base that our partners can also tap into. And last but not least, we have a focus also on our internal value chain, because even more so when we all experienced it in the pandemic, we need to do more and more things remotely. And in the internal value chain pillar, we focused, for example, on augmenting our global customer support with augmented reality, where they then suddenly can you have an augmented reality glass and you can see the service module manual and see which part needs to go where completely remotely. I mentioned earlier that the startup Creasphere is really a funnel for collaborations in the digital health space for us. And we have, out of those 66 already completed pilots, we had 25% of them had a follow-up project, and nearly 50% of them already had a commercial partnership reached. I mentioned one example. This is the point of care platform, the Cobas Pulse example. But we are also building an ecosystem around disease management in the cardiac or cardiovascular metabolic space, where we work with companies like Lark, FibriCheck, SmartCardia, VitaHealth. Maybe some of you are familiar with those companies. Some are European companies, some are more US companies, but it's all about the indications, heart failure and atrial fibrillation. And I just described the augmented reality example, where it's about transforming the 2D training manuals to a 3D application with augmented reality glasses. To put a bit more meat to the bone, what are these apps on Cobas Pulse and our digital ecosystem about? We have GlucoTab, that is a personalized insulin dosing management system. We have GlucoCommander, that is basically the same, but for the US market, not for the European one. We have a wound management software that can basically process the photos from wounds and scanned documents to assess the wound healing. We have CardioSignal that can detect atrial fibrillation just by placing the device on the chest of people and diagnose it within minutes. We have SteadyTemp, that is a smart patch thermometer, and has also a related mobile app for the continuous measurement of the temperatures, and Smart for Diagnostics, that is aggregating the preclinical data and sample handling data. All of that is just a snapshot of a growing marketplace with more and more applications coming onto it. These are really the group of the early adopters. I know this. I've heard that the people from Steady Temp are also, or Steady Sense, as the company is called, the people from the product Steady Temp are also on the call. So I skip that slide, and we can come back to it later in the Q&A, as you can talk through it much more than I can do. And give you just two other examples where we work with companies that are very much focused on the artificial intelligence applications. And if we zoom in now into the product that Procordior is supplying, it's a non-invasive smartphone-based solution for cardiac monitoring. So it's literally something that you can place on your chest, and they are working on, they are already having it cleared for atrial fibrillation, and they're in the process of even getting a clearance for heart failure diagnosis. And we are integrating their solution within our bigger Roche disease management bundles, where it doesn't only go on top of the handheld diagnostic device, it is also integrated into a bigger disease management bundle, where we talk about bringing also remote patient monitoring solution as part of such a bundle, bringing the data infrastructure as part of that bundle, and many more elements. It's about, in disease management, we also focus on tailoring the solutions to the customer needs a lot. So it's more a modular, it's more a toolbox where you then plug and play the required modules. This was an European example mainly. It's pending the commercial availability in the US. I'm switching now to another company that is a purely US-based company, and there it's about a patient engagement solution. We talk about chronic disease management and prevention that is completely facilitated by an AI-based chatbot. And that chatbot learns over time how you interact with it and to which behavioral cues you're acting on the best. And we just had the study reports from a module that was developed by Roche and Lark on the prevention of cardiovascular diseases, and people are staying engaged. We have higher than 90% engagement rates after 3 months, which is much higher than usual. And there is no person, there's no health coach involved. It's basically just the company. It's just the app interacting with the person, giving educational lessons. Also, the weight measurements are submitted every day by a connected scale, and then the people are based coached based on those inputs. With that, I would like to close my talk. I hope I could give you a bit of an insight on where Roche stands at the moment in terms of digital ecosystems, inspire you to hopefully reach out if you have a clinical algorithm or if you have an app that can go on a point of care device. And I would really encourage you to visit our startup Creasphere website to learn more about the program and the collaboration funnel. And with that, I'm very much looking forward to your questions.
Thank you, Eva. Okay, I will just use the opportunity to send you all the link of our collaboration platform. And now I would like to ask you, are there any questions from the audience? I don't see any questions, so we'll start maybe with the first one. So you mentioned this navify marketplace, Eva. So how is Roche selecting these partners? Can you apply for the navify marketplace? Is this also via your startup programs, or is this it's will not be only addressing startups, I guess? So how is this working out?
Exactly. There are a few ways to reach the navify marketplace. On our website, and I'm happy to share the link later, we have a so-called opportunity capture, where you can reach out to our partnering colleagues, and they have a full database of companies that and also use cases for the navify marketplace. So this is sort of the main entry point, our website, where you can submit your more context on your company and why you think how this could work on the Cobas Pulse. We are also attending many events around the world, so you can also just reach out to the Roche colleagues at those events, and they will be able to funnel it to the right people. And the startup Creasphere one is more at an earlier stage, where it's not so much about having an idea and getting sort of onboarded and qualified for the marketplace directly. It's more about figuring out would, for example, a certain digital solution even work on a Cobas Pulse meter, and does that use case even make sense? So it's one step before something can go on the marketplace. Did that answer your question, Pascal?
Yes, thank you. And I've also seen that, like in small letters, it says that the navify marketplace is still like in a pilot scale, and what does this mean? So what is the pilot, and what is or what should be the outcome of the pilot? Or
Very good question. Pilot means that we are now deploying that navify marketplace in the first few countries, and still gathering a lot of customer feedback. So if you it's sort of the early days of the Apple App Store. It's not yet completely mature and available in all our markets. I mean, we have affiliates in, if I recall correctly, around 100 countries around the world. So it's not available in those 100 countries, but it's available in significant markets. And this is why it's called pilot. Before scale, it would mean that it's available in more than 14 or more than 21 markets around the world.
And if I would be a medical user, is there also like a bottom-up approach? So could I just give a feedback? Okay, I'm using this Cobas Pulse, and I would like to have a solution for, I don't know what kind of use case. So suggest new use cases, or is this not envisioned in the near future?
To be honest, I cannot answer on top of my head. I will need to check with the Cobas Pulse community how they are doing it at the moment. But I know that we listen a lot to customer feedback, and especially also our global customer support colleagues. They have collections of these customer feedbacks. But how the process in detail work, I will need to check with the respective colleagues.
Okay, thank you. Are there any questions that appeared in the meantime? I see
yes.
Philip Dunning unmuting, so I assume that he has a question.
Yes, I have. Thank you. I have two, actually. So first of all, thank you for the presentation. My first question is, do you have also use cases developed by Roche itself, and then let's say an environment of partners where you would say this is the right partner to develop this kind of digital solution? And the second question is, I would just in general like to know how patients or healthcare practitioners react to the increasing amount of digitalization in the healthcare process.
to your first question, if I got it right, it's about whether we develop use cases and then sort of give the task to another company to develop the related software.
Exactly.
Okay. That very much depends on the type of software. So we have, but the general answer that I can give without knowing a particular use case, but the general answer is we always ask ourselves, do we build it ourselves? Do we buddy or do we buy it? And this is at the first stage of every development we do. So it's very, if we find a company that has a very unique technology, it can very well be the case that we sign a strategic partnership and ask that company to further develop or tailor their existing solution for a particular use case. If I zoom in on the startup Creasphere activities, there it's often a very open discussion. So Roche might come with let's say a very rough use case. We think there's an unmet need. It somehow appeared, like you asked earlier, Pascal, maybe a physician said, it would be great if we have X, Y in addition. And then we would take that request to the startup Creasphere, scout for companies that can approximately solve that question, not have already the solution fully developed, but can have a relevant technology. And then we would work with that company to detail out how the solution can look like. So it's then more co-development or co-design of that solution. And your second question, could you please remind me?
Sure. I just wanted to know in general how patients and healthcare practitioners react to the increasing amount of digitalization. Or also, I work as a data scientist for Parkside Interactive based in Graz, and particularly when it comes to AI or data science, what are their reactions?
I give you my personal opinion. It's not the Roche general opinion, my very personal one. While working with healthcare institutions and patient engagement groups, especially in Ireland, but also the US, the Netherlands and Finland, just to place it a bit where my experience comes from. We often think that patients don't know how to deal with digital solutions, and that is changing a lot. So we see, even if I work a lot in the cardiovascular metabolic space, so we work a lot with elderly patients, 70 and above, and they are digital savvy. Yes, they might need somebody to connect the Bluetooth scale from time to time, but they are much more much more digitally savvy than we think they are. For me, it comes down more to a usability question. So it's not so much about digital yes or no. I think the question at the moment is how usable do we make it? And at the last slide, I mentioned the company called Lark, and they made such a simple interface with a very sophisticated AI chatbot in the background that makes the interaction with that digital solution so easy that people stay and continue using it for months that we wouldn't have expected to that degree. But it's simple, and I think the same counts also for the medical algorithm suite. If you have 1,000 algorithms, all spread out different websites hosted by scientific organizations, websites hosted by smaller companies, sometimes even by private people, because they found out, if I take this and that value and combine it, it might have an insight. That's overwhelming. But if you bring that together in one single place where you can rely on that it's a certified algorithm, for example, it changes the perception of physicians. So this is one feedback we got is, Roche, can you, together with the digital health community, can you help us to find out which of those innovations are reliable and regulated in a proper way and certified? And then we're more inclined to use it like we use your diagnostics offerings, where we also trust that you have certified them in the right way, etc. So I think it's more, I think to bring it to the point, it's a usability question. Make it as easy as possible for patients and physicians to process the data or to act on the data. That's even more the case. And then the second point is about whom do you trust in sharing the data, processing the data, and yeah, whom do you trust with relation to the evidence behind algorithms?
Do you need to get certified in some sort of way when it comes to these solutions, or when is this done?
Yeah, I mean, it always, back to your use case question, it always depends on the use case, but many of the algorithms we have on the algorithm suite are certified, and the algorithm suite is built under the quality measures and quality systems that are required to host medical grade algorithms. So we have our so-called navify cloud that runs in the background. It's a cloud instance with a continuous cybersecurity surveillance. So even if we work with partner where we wouldn't have any of our own solutions, we can put that on the navify cloud instance and then have the cybersecurity sort of taken care of, at least for the inputs and outputs.
Thanks.
Any other questions? I mean, as Pascal mentioned, you can also reach me via the community platform if there is something coming up afterwards that is not yet on top of your mind.
Yeah, I think we don't have any more questions. So I would also use the opportunity, of course, to encourage you again to register on the collaboration platform. And I also want to release you in the pre-Christmas stress or last shopping. So if you are still need some presents, and thanks again to Eva for this really interesting talk and also the discussion afterwards, and have a wonderful afternoon, evening.
Thank you. Goodbye.
Thank you. Happy holidays.
Thank you.
Thank you.
Thank you so much. Bye.
Bye.
Thank you.
Happy holidays.